Hey everyone, I am Hamsida H. Abduraja. Today I am going to perform the newborn screening. Newborn screening is a public health program of screening the infant shortly after birth in order to find the conditions and to treat them early. The purpose of this procedure is to find the congenital metabolic disorder, and this test can also identify the cause of the brain damage or death if not treated early. Materials that I'm going to use is the lancet, gauze, cotton swab, alcohol, and water and cloth. Before and after the procedure, obtain the consent from the parents and verify the infant identity. After the procedure, follow up the result. And things need to document the procedure. Then to make safety, make sure that all the materials that we are going to use are clean and disinfect the infant's heel before getting the sample. Verify the physician order. This is to know the right patient. Assemble all the necessary equipment. This is to save the time and effort. Consent from the parents. This is to avoid misconduct. Verbally confirm the baby full name, date of birth, and the parents. This is to know the right patient. The name of the baby is Fatima Anisha Abdullah. Date of birth is born on July 4, 2020. Mothers, Siti Mariam Abdullah. Complete the information on the card care, and care must be taken to avoid contamination. This is for the legal purposes. Avoid touching the area on the filter paper, particularly on the circular, during and after and before the procedure. This is to avoid the contamination. Recommend the comfort measure to the parents, such as the face-to-face or the suckling or feeding. This is to provide comfort. Warm the site with the warm cloth, moisten with warm water. This is to improve the blood circulation. Clean the site with the alcohol swab from the outwards and dry the heel using the circular motion. This is to prevent the contamination. Hatch the area and indicate the safe site. This is to maintain the safety and to obtain the sample correctly. Now the foot hang down and to maintain it in the dorsiflex. This is to expose the site of the puncture. And prick the heel with the lancet of depth 1 to 2 mm in the lateral and away from the medial aspect of the calcaneus. This is to obtain the desired sample. And wipe away with the gauze pad. This is to avoid contamination of obtaining sample. And apply the blood one-sided of the filter paper, and the blood soak and fill the circle of the filter paper. This is to obtain the good sample.
Memorize ko yan. Bas. Sa pang lahat na.
Tanda ka na.
Babasa ka kami yan ang buhok.
Fill the remaining circle using the same step. This is to completely fill the circle. And wipe the excess blood from the heel using the gentle pressure with the cotton balls. This is to stop the bleeding. And allow the specimen to dry thoroughly in the flat surface. This is to avoid spill of the specimen. And mail the complete result of the laboratory. This is for the continuation of the process. And inform the parents on how you receive the result. This is for the guidance for the parents. Document the procedure. This is for the continuation of the process.